Hello and welcome. My name's Jonathan Bird from the University of Exeter. Today, Professor Costas Karageorghis and I are going to present some of our COVID-19 related work examining physical activity behaviours and mental health in the UK. The COVID-19 pandemic has influenced every single one of us in some shape or form. There have been over 1.7 million cases of COVID-19 in the UK, as well as both national and localised lockdowns to reduce the spread of this infectious disease. The work that we're presenting today took place earlier in the year, between April and May, which corresponded with the initial COVID-19 lockdown. Although the lockdown was certainly a necessary step to slow the spread of COVID-19 cases, researchers quickly began to express concerns that lockdown would be associated with a sharp decline in physical activity and a detriment in mental health. Now, we know that large segments of the population fail to meet the recommended quantities of physical activity, and we also know that mental health issues are prevalent, so this really is cause for concern. Researchers suggested that we need to identify the factors that influence physical activity in the context of COVID-19, and by extension, the factors that underlie mental health, and that such research could help inform practice and policy for additional periods of lockdown. With that in mind, Costas, Mark and I designed a study back in March to elucidate the factors that influenced physical activity and mental health pre and during UK lockdown. We had two main aims for this study. Firstly, to examine the extent to which exercise motives predicted physical activity pre and during lockdown. And secondly, to investigate the degree to which physical activity and sedentary behaviour was associated with mental health pre and during lockdown. We developed an online survey using Qualtrics and promoted it via social media. It was a one-off survey and participation was restricted to adults who resided in the UK. Data collection occurred during the initial UK lockdown, and so pre-lockdown measures were taken retrospectively. We didn't offer any form of incentive for participation, and a total of 392 adults took part. In terms of measures, we used the BREC3 to examine motives for exercise. We used the BLPAQ to tap physical activity behaviour. Importantly, this measure makes a distinction between planned forms of physical activity, which is scheduled into a daily routine, such as cycling to work, and unplanned physical activity, such as the odd instance in the garden. We also recorded participants' average daily step count, but only if they used an electronic device to monitor this. Sedentary behaviour was measured by asking respondents to specify their average daily sitting and screen time, and mental health was assessed using the GHQ-12. The survey was designed such that all pre-lockdown measures were administered first. Thereafter, participants completed the questionnaires again in relation to their experiences during lockdown. Following data screening, standard multiple regression analyses were used to predict planned physical activity, unplanned physical activity, and daily step counts from BREC3 factor scores. And we did this for the pre and during lockdown responses. Next, we used hierarchical multiple regression to predict mental health from planned and unplanned physical activity pre and during lockdown. Partial correlation was used to examine the relationship between steps per day and mental health, while controlling for body mass index pre and during lockdown. Finally, hierarchical multiple regression was employed to predict mental health from sitting time and screen time pre and during lockdown.
Hi everyone. So looking at the scores on the doors, we began by clearly screening out for univariate and multivariate outliers and by checking for normality in each cell of the analysis. What was very interesting about the standard linear regression to predict planned and unplanned physical activity from self-determined motives that stem from the BREC3, albeit both predictions pre and during lockdown were significant. We predicted far more of the variance pre than during. So as you can see from the note there, some 44% of the variance in planned physical activity was predicted by the self-determined motives pre-lockdown, but only 25% during lockdown. Now, one of the interesting things that we did in the analysis was that we turned all of the scores that we analysed into standardised scores, and we've plotted the standardised betas along with standardized confidence intervals, which you don't ordinarily get when you run a regression analysis. So what this allows us to do is to compare these standardized betas from pre to during lockdown to see whether the confidence intervals, either lower bound or upper bound, cross a mean. And if we look at those confidence intervals, we can see that in terms of identified regulation, there is a difference from pre to during lockdown. So there's a stronger prediction pre-lockdown compared to during lockdown. And as we looked at the prediction of unplanned physical activity using the self-determined motives, the result is pretty much as we hypothesized, because we can see that the percentage of variance that is predicted by the model is roughly equivalent from pre to during lockdown, around 10% pre and 9% during. The other interesting thing is, if we look at the plots there of standardized betas and the standardized confidence intervals from pre to during lockdown, there are no differences. And remember that in this instance, where the confidence intervals don't cross the dotted line at 0.0, that is indicative of a significant prediction. So we can see in this case that intrinsic regulation was a significant predictor of unplanned during lockdown, and integrated regulation was a significant predictor pre-lockdown. Now, this prediction using exercise motives as predictors of steps per day is on a subset of the data, and on a subset of the data for individuals who routinely monitored their daily steps using an electronic device. So you need to consider that these people are essentially quite motivated to maintain their average daily step count. We don't see differences from pre to during lockdown in terms of those standardized betas, and you will notice that pre-lockdown intrinsic regulation is a significant predictor of steps per day. The overall percentage variance that is predicted is roughly analogous from pre to during lockdown. The next stage in proceedings is that we used a hierarchical regression analysis to predict mental health, as represented by GHQ-12 scores, as John mentioned earlier, using the predictors of planned and unplanned physical activity, which held from the theory of planned behaviour. Now, we can see that the prediction pre-lockdown is marginally non-significant, but there is a significant prediction of mental health during lockdown. Now, if we look during lockdown, both planned and unplanned dimensions of physical activity are significant predictors. And it seems that the more planned physical activity and the more unplanned physical activity you do, the better your mental health, because the standardized betas indicate that planned and unplanned are significant negative predictors during lockdown. you'll recall, as John mentioned earlier, that we use steps to predict mental health through the medium of partial correlations. These were non-significant, and actually the coefficient of determination only accounted for 1% of variance pre and during. So we haven't plotted those, but what we have plotted here is sedentary behaviour in the form of sitting and screen time as a predictor of mental health. Now, what is interesting is that despite the fact that the models pre and during lockdown are significant, we have a greater proportion of variance predicted during lockdown. So it's 5% during lockdown as opposed to 2% pre-lockdown. I just want to note there that screen time during lockdown is not a significant predictor, but screen time pre-lockdown is a significant predictor. And a slight limitation is that, of course, screen time can be a subset of sitting time in this particular context. So maybe the sedentary behavior is not as a bigger predictor as we might expect, but we will explore the reasons for that in a short while. So now we come to the discussion. What does it all mean? Well, in accord with our first hypothesis, the self-determined motives that were predicated on BREC3 were stronger predictors of planned physical activity pre-lockdown when compared to during. So clearly those individuals who were self-determined to engage in physical activity had those motives thwarted somewhat by the government restrictions associated with lockdown. Now, unplanned physical activity, which of course doesn't have such a strong conscious basis, it happens in an unpredictable and ad hoc way, that exhibited little difference in terms of predicted variance from pre to during lockdown in accord with what we expected. Now, these data suggest that any unplanned activity that people are able to experience under lockdown, be that playing with their kids or maybe pottering around in the garden, if they have a garden, has potentially positive consequences for their mental health. But one important point to note is that reversed causality is also a possibility in this instance. What do I mean by that? Well, for example, De Silva and collaborators have shown how compromised mental health can limit the degree to which people engage in physical activity. Okay, so it's not just that physical activity can compromise mental health. If someone experiences decrements in mental health, this can have negative consequences for their physical activity patterns. As we expected, sedentary behavior predicted a greater percentage of variance during versus pre-lockdown, but no great shakes there, only a 3% difference. Why such a small difference? Well, we know a lot of people were watching Netflix or they were playing immersive video games. There's been some very interesting research recently from Oxford University, which shows that playing immersive video games for even up to extreme lengths of time, such as 4 hours per day, can be additive in terms of people's well-being. So being sedentary does not necessarily equate with decrements in mental health. It depends what you do while you're sedentary. As in any study of this nature, there were strengths and limitations, and I think it's important to acknowledge these. We did manage, by a stroke of luck and getting relatively rapidly through the ethics process, to collect data during the strictest period of the initial UK lockdown. And we were able to integrate several theories in the selection of predictor and dependent variables, such as self-determination theory and the theory of planned behavior, as you've already heard. But of course, in using a cross-sectional design, this restricts us from any claim of causality, and we have only associated variables. In so doing, we use the retrospective frame for those pre-lockdown measures. So, of course, we need to acknowledge this as a limitation. Moreover, in any survey on Qualtrics, Lime Survey, or any sort of online platform, there is an inherent self-selection bias. So we struggled to collect responses from individuals with a BAME background, for example, or even those representing lower socioeconomic groups. Interestingly, 80% of our respondents were women and only 20% men. So perhaps in the future, we should use offline methods in tandem with online methods to encourage more men to respond to the survey. So what about some conclusions and recommendations? What are we to take away from the study? Well, it seems that people's self-determined regulations to engage in planned physical activity were thwarted to a degree by lockdown-related restrictions. And of course, a lot of exercise facilities, both indoors and outdoors, were closed. Even some parks were closed in London. And I think this hints at the importance of trying as much as possible with COVID-secure restrictions to keep such facilities open. Interestingly, when we look at the combination of physical activity and sedentary behaviour, this accounted for around 15% overall in the variance in mental health during lockdown. So not to be sniffed at, that's a fair amount of variance when we compare sedentary behaviour and physical activity in the round. So what about some recommendations for public health authorities and for government? I don't think it's outlandish during periods of national lockdown for governments to consider apportioning 30 minutes of every day to exercise. I mean, at a population level. We've had some real stars emerge during lockdown. There's Joe Wicks there, who became an overnight celebrity. We do have the technology and the talent in this country to get the whole nation active for periods of the day. In many Japanese organizations, this has been par for the course for many years, and I think we should give it serious consideration for future lockdowns. Also, I think that government messaging needs to make much more of the potential benefits of intermittent movement throughout waking hours. What do I mean by that? Well, I'm seeing that people did manage in many instances to maintain their planned physical activity, but they're also sat for extended periods of time, maybe 8 or 9 hours a day, or spending excessive time in front of a screen. So breaking that up with intermittent periods of movement, maybe marching up and down the stairs 5 times, doing some star jumps, going for a walk around the garden, is potentially beneficial not only for physical health, but also for mental health during periods of lockdown. That brings us to the end. Thank you all so much for listening. Do keep in touch. You have our social media details there, and we look forward to hearing from you in case that you might have any questions.